Are you looking for a drugless, non-surgical approach to help support such digestive disorders as irritable bowel syndrome, inflammatory bowel disease, diverticulitis, diverticulosis, ulcerative colitis, celiac disease, or Crohn's disease? I'm Dr. Roy Picard, and my degree is in chiropractic, but what I utilize in my office is functional endocrinology, chiropractic neurology, nutrition, and brain-based therapies. I work with a lot of sick, chronic cases, including those who have digestive disorders. With proper testing, dietary changes, along with the appropriate nutritional supplementation, you can make a decrease in your suffering and make your life much more enjoyable. Depending upon your specific condition, you're more than likely already taking medications to decrease the pain, the suffering, and the damage to your body. However, like most people, you have your concerns. You're probably wondering, are the drugs doing what they're supposed to? What side effects will I eventually have to deal with? Is there something that is safer that I can do with very little risk? Are all these drugs doing is just masking the damage that is continuing to go on in my intestines? What will I do if these drugs don't work? Will I eventually need surgery if I stay on the same path? Depending upon your specific condition, you may not even feel threatened by surgery, but there still remains the fact that when your gastrointestinal tract is not functioning properly, at times it can be nearly impossible to leave the house for such things as groceries, a social gathering, work, or even school. Because of the damage to the intestinal tract, not only are you dealing with the potential pain, bleeding, vomiting, diarrhea, fatigue, and other symptoms directly associated with the damage, but there's also all of the other symptoms that are indirectly involved, such as weight loss, headaches, the decline of tissue, gland, and organ function due to lack of nutrition, anemia, brittle bones, and much more. What are some of the things that can lead to gastrointestinal problems? Well, it can be a problem with stomach acid, bad diet, a decreased immune system, or you may have an autoimmune condition where your immune system is attacking the lining of the gut. If your gastrointestinal tract is not functioning properly, you need to know what can be done to help turn things around. With proper testing, you will learn such things as what foods are good for you, which foods will do harm, what nutrients you may be lacking, what nutrients can have a healing effect on the gut, which foods may be triggering an autoimmune response, such as in the case of Crohn's, and there's much more. Most people that I have worked with are shocked to find out the foods that are actually harmful to them. Making the necessary dietary changes, along with utilizing the appropriate nutritional supplements, has proven to be a great benefit to many people who previously suffered with a gastrointestinal tract disorder. My recommendation for you is to call the office to schedule a $27 screening so that you can learn what you can do to decrease or stop your suffering. And during this $27 screening, I'll go over your history, perform a set of non-invasive tests to determine if you qualify for care, explain what your options are, discuss the potential cost of care, and I'll answer all of your questions. Again, I'm Dr. Roy Picard. I wish you the very best.